Neutrophils are the most numerous white blood cell, except in cattle, which is lymphocytes is the most numerous. Their primary function is phagocytosis of pathogens, and they will be increased in the blood in cases of infection or inflammation. Their lifespan is usually about 4 to 6 hours. Their nucleus will have 2 to 6 lobes or segments. They are granulocytes, and the granules are usually only lightly stained. Granules and granulocytes contain chemokines, cytokines, and enzymes. Neutrophils are also known as polymorphonuclear because they have multi-segments in their nucleus. The immature form does not have segments, and it's called a band cell. These are increased when there is inflammation or infection. Older cells may have more segments. When there is inflammation or infection, there will also be toxic neutrophil changes, such as Dolly bodies being present and more granules being present. Neutrophils are involved in tissue repair and anti-inflammatory action as well. Eosinophils only have a lifespan of a few days. They take up a very small percent of the blood, 1 to 4% of all the white blood cells, and they have very large pink or red staining granules. So they are a granulocyte. They're involved mostly in allergic reactions and parasitic infections. Again, their granules will release cytotoxic proteins, cytokines, and chemokines that will fight the parasites. They also are involved in tissue repair and anti-inflammatory responses. Basophils, which have a lifespan of about 4 to 6 hours, are rarely seen in peripheral blood because they take up about 0.5% of all the white blood cells. Their nucleus is usually bilobed. They are granulocytes, and their granules stain blue, and they contain histamine and heparin. These are involved in inflammatory and ectoparasite infections and allergic reactions. Studies show that they may also aid in hormone production. Monocytes have a lifespan of about 2 to 3 days. They take up about 4 to 8% of the white blood cells. They are the largest white blood cell, and their nucleus has a kidney shape, which does not stain as dark as some of the other cells. It is an agranulocyte, meaning it has no granules. Monocytes enter tissue and they become macrophages, where they perform phagocytosis and engulf pathogens. They may have a foamy cytoplasm due to vacuoles in their cytoplasm. They are also antigen presenters, bringing pathogens to T cells. They also aid in hemostasis or clotting, tissue repair, and inflammation. Lymphocytes, which may live for months to years, compose 20 to 45% of our white blood cells. They're the second most numerous white blood cell, except in cattle. They're agranulocytes, meaning they don't have granules, and their nucleus is round and takes up about 90% of the cell. Unless they're reactive, you may see more cytoplasm. They attack specific antigens, produce antibodies, and differentiate into T cells, B cells, and natural killer cells.